Hello moms, today we are live at Baby Destination page and we have Dr. Namrita with us.
Hello everyone.
So thank you Dr. Namrita for coming and joining us.
It's my pleasure to be here.
So we get lots of query around breastfeeding, breast pumps. So I want to ask, what is the concept of these breast pumps?
Okay, so at the outset, I guess I would like to kickstart this talk by emphasizing on the fact that breastfeeding is the best source of nutrition for the babies. And it has a lot of advantages and also reduces the risk of a number of short as well as long-term health conditions in both the mother and the baby. Now, if we come to breast pumps, what are breast pumps? So, breast pumps are actually mechanical devices which lactating women use to express milk from their breasts.
So, does it harm the body of a woman or does it harm the baby?
Not really. So, I guess breast pumps have a lot of advantages. I would not advocate one over the other. I'm pro-choice, so ultimately it depends on the individual. It's a mother's prerogative to choose whatever she feels is more suitable to her lifestyle. But breast pump does have a lot of advantages. Number one, I think most of the women today are working. And working women have a very busy schedule, right? So it may not be possible for them to breastfeed their baby at all times. So, and some women have to join work after 2 months. They may not get leave. So instead of giving the baby top feed, you can. So if the lady, uses a breast pump and stores that milk, that the caregiver or the husband or someone in the family could give the breast milk to the baby. That's one. Secondly, sometimes women who have excessive milk supply, they develop breast engorgement, which is quite painful. It can lead to fever. It can cause a breast abscess later on, and can even cause breast abscess. So it is important that you empty your breasts at regular intervals. So breast pump could come handy there as well. Sometimes babies also have poor latch on the breasts, or they have a condition called as a tongue tie, because of which the baby is not able to feed properly. So in those conditions, if you want to give breast milk to the baby, it's a wonderful alternative.
Yes.
Also, sometimes women have a condition known as a retracted nipple or an inverted nipple. So I would first suggest that the mothers with retracted nipples or inverted nipples should show to a doctor, a gynecologist. And if no medical condition for the same has been found, breast pump could be a kind of a treatment in the sense that the suction in the breast pump cause the inverted nipple to get corrected.
Okay.
And they can.
So it helps.
It helps, yeah, because the suction that's being created. Okay. So because of which, so they'll be able to, take out the milk and feed the baby. And another very important thing I feel is it also breast pumping also helps to increase your lactation. Some women have reduced milk supply. So if you do breast pumping along with breastfeeding, it also augments and boosts up your milk supply. So that is another very important advantage. Also, some women, I guess, do it just because it's convenient. Pregnancy in itself takes a toll on our health. And then you have a baby, which is, I think it's a new environment to be in. And, so many women are not able to sleep properly because of waking up in the night to breastfeed. Yes. So, if at night, if, you have, if you give bottled milk to the baby, which is your breast milk, which is being pumped out by you, and probably even the husband can share the responsibility. So it's like also about, sharing the responsibility of raising a child. So breast pumping has its advantages.
So moms, जैसे कि आपकी queries रहती हैं कि babies अच्छे से milk breast जो है वो suck नहीं कर पा रहे हैं या उनको problem हो रही है या आपके inverted, तो these breast pumps can help you.
हाँ, तो उसमें काफी इसकी help हो सकती है.
Yes, काफी इसकी help हो सकती है. But first go to your gynac and check कि अगर
cause of retracted nipple.
Yes.
अगर retracted nipples हैं तो it has to be checked first. What is the cause?
Yes.
And if there's no medical condition, then this is one of the ways that you could correct it.
Okay. So, I have heard कि breast pump अगर use कर रहे हैं moms, तो उनको milk supply भी में भी growth होती है, मतलब milk supply बढ़ जाता है.
So breast pumping increases your milk supply, definitely. इसमें भी depend करता है whether you're exclusively breast pumping or you're breastfeeding and breast pumping together. But let's say a lady is exclusively breast pumping, वो सिर्फ breast pump use कर रही है, breastfeeding बिल्कुल नहीं हो रहा है. So then she has to follow the natural cycle, the natural feeding cycle of the baby, where the baby takes the feed about 8 to 12 times in a day. So the breast pumping cycle has to mimic that. So you must breast pump 8 to 12 times in a day. That would be 2 to 3 hours. After every 2 to 3 hours, not later than 3 hours. And even at night, you'll have to breast pump.
Okay.
To maintain the milk supply. Because actually the game is of supply and demand. The more the baby demands the milk, the more will be the supply. So similarly, you need to do it for breast pumping as well.
Okay. So we have also posted questions around breast pump in our Facebook groups because you were coming. So moms have asked some questions. So
yes,
we will be taking those questions. So first question, Cheshta Paul have asked, while using manual pump, my muscles got hurt and I used to get lot of pain in the breast at the back of it. So what can be the reason?
So sometimes in these conditions, you need to adjust the settings of the breast pump. So the breast pump that we use, it is used in cycles per minute. So sometimes if you have set it to 30 cycles per minute, that means, so it is actually the time in which the nipple will enter into the suction pump and release of milk. So if you set it to 60 cycles per minute, so the time that the nipple, the time for which the nipple is in the suction pump would be less. So pain would be a little less.
Okay.
So first, ideally for her, I would suggest that she should show to a gynecologist. और एक बार वो अपने gynecologist को दिखा लेती हैं और वो review कर लेंगे. Then she can show the breast pump settings also, and those need to be actually changed in that case. Generally, अगर आपकी settings में गड़बड़ है, उसमें it can happen. You have to check the apparatus also whether it's been fixed properly or not, and then whether she has any cracked nipples and all that needs to be looked into.
Okay. So,
but most commonly it's because the time the nipple is in the breast pump, usse causes pain, so that needs to be seen.
Another question asked by Jaya: how long we can store this milk after pumping?
After pumping, yes. So once you've extracted the milk, so either the baby should take the milk within 4 hours. If you've kept it in the fridge, you can keep it in the refrigerator for 4 days, and you can freeze it also, which means deep freezing. You can freeze it for 6 months to a year, but then you must freeze it in a separate freezer, where you don't keep opening the door again and again.
Yes.
Because then you will play with the temperature, and so that is one advantage of breast pumping, which I feel that there's so many women who are not able to produce milk. उनका milk production होता ही नहीं है. So rather than giving top feed to the baby, there are also milk banks which are there these days.
Yes.
Where women who have excessive milk supply, they generally donate milk in the milk banks, which can be used by these babies. Because breast milk is definitely better than any
other milk.
Yeah, which is there.
Yes. So we can store it to 4 hours. If not in fridge, you can store it.
Yeah, you can keep it
at normal temperature. Also, one more question by Gitanjali. Breastfeeding के कितनी देर बाद we can pump breastfeed? Like breastfeeding अगर करा दिया है बेबी को, तो उसके कितनी देर के बाद हम पंप कर सकते हैं दोबारा?
So after half an hour. After half an hour is a good time to breast pump. It depends. So in her condition, probably she's doing both of them together.
Yes.
She's breastfeeding and breast pumping also.
Yes.
So breast pumping she would be doing ideally probably maybe to increase the milk supply. So she can do it after half an hour. And she needs to keep doing it throughout the day.
Okay, let's see if there are more questions around it.
कई लेडीज जिनका बहुत कम breast milk होता है, उसमें there's also something known as cluster pumping जो हम कर सकते हैं, which you cannot do for a prolonged period. You would do it for 2 to 3 days probably. इसमें क्या होता है cluster pumping में, that you will you'll use a breast pump, or even if you're nursing the baby, you can nurse the baby. You'll do it for maybe 10 minutes and then you'll stop it. Then after half an hour, you'll again do it for 5 minutes and then you'll stop it. Then you'll again do it after half an hour.
Yes.
So for 5 minutes and then you'll stop it. So you keep doing it throughout the day for 2 to 3 days. This really boosts up the milk supply. It's called cluster pumping. Yeah.
Okay. So moms have also asked these questions like, does using breast pump a question on a motherhood?
I don't think so. I do not support that thought process. I think it's so the ideal way would still be to put the baby on the breast, but there's no right, as I earlier also said, there's no right and wrong choice. The only right choice is whatever is in the best interest of the individual or the mother.
Okay. So does these breast pumps have any side effects like on body?
Not really. I mean, like I said, if the machine is properly calibrated and the suction pressure is set to the right degree, there are no really real side effects as such. But there could be. So there are certain issues in the sense that the storage issues could be there. It's maybe a little inconvenient. Privacy issues. Then you have to sanitize it every time. So it's not. People may think breast pumping is very easy, but it's also it could be quite cumbersome. Because you need to clean it. All the milk residue which is there on the nipple shield, the breast pump, the bottles, all that needs to be properly cleaned and sanitized every time. So all those factors have to be a little more expensive than your breast milk. So all those factors have to be taken into account. And also the natural immune system, the immune process would be slightly lower. Like when the baby latches onto the breast, the saliva of the baby also mixes with the milk and it sends signals to the brain. And the breast milk which is produced is actually a customized feed for the baby, what the baby actually needs. Now in breast pumping, it may not be, so it is quite alright, but it may not be the immune, because the natural feedback loop is not maintained. The immune properties of that milk may not be as great as what breast milk would be.
So I wanted to ask this question earlier as well. Like, then why moms hesitates using this breast pump?
I guess anything that is new takes a little time for people to get used to. And also maybe there's not much awareness around it.
Yes.
So we need to create this awareness that they have an alternative available, because sometimes women don't have an option. And especially, let's say a child who has a tongue tie, what do you do? If the child has a poor latch, what options do you have? So
here also pump is a savior for those moms.
Yes, I agree.
So moms, breastfeeding is the best for your baby. In case you are not able to breastfeed, then you can use these breast pumps. Like if you are joining work or you have inverted nipples, like doctor said, and if your baby has latching problem,
yes,
so you can use these breast pumps in those
and
situations.
And also help to increase your milk supply.
Yes, this is the best.
Yeah, so it is not necessary कि हमें एक को ही use करना है. अगर आपका milk supply कम आपको लग रहा है, तो breast pumping also increases and boosts your milk supply.
Moms, I hope आपके questions around breast pump answer हो गए हैं. You can keep asking your questions in comments below. So doctor will answer all your queries, I hope.
Yes.
So thank you moms for joining us and asking queries. And I hope this session was useful for you. So bye.
Bye. Thank you.